Hi, my name is Eva Steiner, and this is my project Psychotherapists Around the Globe. I am interviewing the psychotherapists around the world and asking them the same 8 questions. I am wondering how mental health profession is in their country. Today we are going to
So let's start. Camila, thank you for doing this interview with me. Before we start with the question, can you tell me a little bit about yourself?
Well, I'm Camila. I'm from Chile, and I am 29. I've been a psychotherapist for almost 5 years now. I have a team of colleagues, and we work together. We've been together we're going to 3 years working together. And right now, I'm only doing online psychotherapy and traveling a little bit. So it's different to be in another country, but only seeing Chilean people.
Good. So let's start with the questions.
Mhm.
First, tell me a little bit about your culture. What is some holidays or traditions that your country celebrate? And if your culture would be an emotion, what emotion would it be?
I was thinking about the holiday because actually, for a Latin American country, Chile, it's kind of, I wouldn't say shy. I will say we're more off. When you think of Latin America, maybe you think Colombia, Venezuela, Brazilian people, even Argentinian people. They talk and they move and they dance. They're like in the street dancing. Like Chile, it's really different in that way. So a holiday that it was like a big thing here, it's the independence, that it's on September.
Mm-hmm.
And that's a big deal because usually, well, now past few years we have like a whole week of of work, of everything, so people just go crazy. But I wouldn't say it's like a holiday. I mean, everyone is doing something, or going to the beach if you live in the city, hanging with friends. There are a lot of festivities, like places where you go and dance the traditional dancing that it's called cueca. It's like basically the imitation of a rooster and a chicken just flirting, kind of. And that's it. So we try to keep the culture, the past, but at the same time the indigenous people, it's something that maybe the last 20 years we're integrating more to actual society.
Mm.
Like Peru, for example, they really take advantage of all the richness of the ancestors. But here is different. And the last is said, if
About
my
the emotion, what emotion
yeah,
would it be?
that is difficult because I think me as a therapist, I have like some like glasses on. So when I saw the society before going, I was so inside the sickness of the society right now here that then I went away, and now I came back for these couple weeks, and I will definitely say it's anxiety.
Anxiety. Mm-hmm.
Yes.
How come?
And
Tell
yeah,
me a bit more.
I think mm, not only with my own clients that are Chilean, I would say that I see it in my family, I see it on my friends, I see it in every generation, because usually sometimes like an older generation, then the millennials, then the newest generation will be different. But what I see as a main curse is anxiety, but not in a good way. So here they call it stress, but
Mm-hmm.
as a therapist I can see that the main thing is anxiety. I notice like people is really 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 ill right now. Like you can see this, like in Santiago, the capital. It's it's super, it's rough. It's rough to go outside. It's like, don't talk to me. Like everyone, it's in this fear culture that the social media, the TV, and you know politicians, whatever. But there is a fear culture really strong, so people stop living their lives. I cannot go out alone after it's dark because I will get robbed or kidnapped. It's the fear because now that we have more violence, not more violence, more violent crimes. Like pickpocketing is like, okay, that's normal. But right now in the news, they're showing a lot of kidnapping or hitmans, like drug problems with a lot of violence, guns. Guns are not normal in our countries. And right now we have more guns. So people, it's really scared. And the poverty after all happened with COVID, the poverty is just people are desperate. So I can see people are struggling with anxiety in different levels, like 4 types of anxiety. You have it all. I can see it closely, people in like micro things on day-to-day basis, but I can see globally when I came back and I just saw the society, just going out, watching people's faces, the questions they ask is like future, 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 and a lot of complaint. So it's been really sad noticing that the anxiety is even worse after, coming back to normal life after COVID. I think obviously money has a big deal there. I mean, but anxiety for sure, I can
Are
say.
these also topics in the session then, the gun violence or the poverty?
I think no, but when I talk about with my clients how things are in Chile, sometimes I just like to ask because I'm not there, and they kind of all said. I mean, some of my clients, like the millennials, centennials, people more with critical thinking, they notice like everywhere they're telling you be afraid, you know but then I can see the older people, maybe my parents, maybe my aunts, uncle. I can see them believing all that. Yes, it's more dangerous. So then in the summer we have fires in different parts of the country. It's like a normal thing. So this year was a huge deal. The fires were, so people is always like this. When is going to be an earthquake in now the earthquake in Turkey? It reminds us the earthquake that we had here 2010, that it was like 4 days ago in 2010. So it's like people is always like this. So when you are alert like this, that's just anxiety.
Yeah. Okay, so how did you become a psychotherapist and what is your therapeutic approach?
Well, I became a psychotherapist. I here you go to the university to study psychology. You don't do like a 2-year general thing and then you do the specialty or something. No, you just go study psychotherapy. It used to every career here, like a degree, not a technical career. It's for 5 years. So I study 5 years and then I have my degree of psychologist. And then it's not a requirement, but many people study to specialize in something. Even if it is clinical or human resources, whatever, but then you specialize because obviously the career, it's really general, even it's 5 years. But no one is regulating that. So if you finish your 5 years, you can do whatever you want. You can open a center and you have the degree, so you can do it.
Okay, so you studied 5 years of
Yes,
psychology, and then if
exactly.
you want, you could specialize, but you can as well work already in a different
Exactly.
areas like clinical psychology and
Exactly.
others. Okay.
But I can see like a tendency of people starting to work in something and then saying, I like it, I will study and specialize. Not necessarily, sometimes not necessarily in university again as a, we call it magister. It's the master degree for you. But magister could last between 2 to 3 years. In Europe, for example, it's only 2 years and then 2 years if you do the PhD minimum. Here it's like PhD 4 years. So definitely here things are longer if you study. So I studied the 5 years and then I've just done like a 1 year thing, like a course, like a thing that we call diplomado, that it will be like a small master. You just study 1 year, one specific topic, 10 months, that's it. So here it's different than in Europe. That is the other experience I've been noticing because I lived there for a year. That's how you become a psychotherapist. So you can have your center and be a clinical therapist just having the 5 years.
And then you choose your approach, or you just say, okay, I will work Gestalt or Psycho. You choose it yourself, or?
Exactly. Yeah, I mean, I think it's more on the person to choose. I mean, if you're gonna be a clinical psychologist, I don't know anyone who is like, I'm just a clinical psychologist. We all have something that it kind of touch us and it's like, okay, this makes sense to me, so this is my clinical approach. Right now, what I'm doing and what I really can relate to, it's phenomenology. That's like my theoretical approach. But I've been studying a lot of psychedelics and assisted therapy with psychedelics, and I've been studying mindfulness because obviously I can see my Chilean clients getting a lot of benefits when they learn how to deal with anxiety. Because here it's like a really capitalist country, like the small, ugly cousin of the US, the wannabe, the small cousin that is, I want to be like that. We try to be like the US in many things, but we tend to not have any tools. So you can see people just being angry in the street, driving really angry, and it's all because they don't know how to regulate themselves. So mindfulness, it's something that I've noticed in using it with my clients in session, teaching them, guide them, even if I'm not like 100% an expert, it's having a lot of good results. More than just the narrative therapy. That's just one part.
Yeah. And how society looks upon psychotherapy or any psychological help?
Here it depends of your age, but not necessarily biological age. Sometimes you have like young people in their 20s, but they have a mentality of people that are like Generation X, and some millennials. I can tell millennials, we are divided in there, like the woke millennials, that is more conscious, more critical, for example, in women feminism, activism, and then you have the millennials that is just like, I just want to live quietly, and so psychotherapy depends a lot, but I can see in the millennial range of age, I can see, I mean, for example, stand-up comedy. Comedians now are talking about mental health. So in this society specifically, I will say we're talking about therapy more. It's like it's a joke that you say, go to therapy, like someone is doing something like kicking a door because he's angry, is like, go to therapy. So I will say from 40s, people that are going to the 40s and down, therapy, I mean, centennials, it's like, if you haven't gone to therapy, check yourself, But then you have older people that is like, therapy, no, I'm not crazy. Why should I go there? I don't have mental problems. So obviously it depends of the circle you move, but the tendency that I can see is that people is so sick mentally, and the society is so sick right now that people is just desperate. So they're talking more, not only therapy, just healing processes like Reiki or what's the other, Bach flowers, like alternative therapeutical things. But I really think people are more open to receiving help than 20 years ago.
Do you have a lot of these alternative options in Chile?
Yes, there is a lot of, obviously we are really capitalist, so everything it has to have a profit, but it's starting to have right now like a really wellness movement and awareness, like people having startups or a small business, like entrepreneurs that are selling things that are like natural, made with their own hands. I can sell a soap that is made from me, like 100% natural. So it's the same with the healing process, psychotherapy. So I think it depends. Obviously, we are a really classist country. So people with money, they have their different issues that people with no money. But in the general, I would say that people are talking more about going to therapy. But when you're younger, it's like less strains to go to ask for help. For example, the oldest client I had is just will be right now will be 57. That's the oldest. And usually when all these people go to therapy, they are in the public health, so they cannot afford psychotherapy privately, so they go in the public system. So I don't have that data. I can just talk about what I see, but I can for sure tell that older people sometimes are like forced to go to therapy. And then they realize, oh, this is good, you know?
And how approachable then psychological help is?
It's difficult because here it depends where you live and how much money you have. Like if you have money, obviously it's like, you know, basic capitalism. If you have more money, you have more options. If you have less money, it's like I can only go to public system. So that is a thing that I don't like, obviously. And for example, right now I've seen some colleagues having charging a lot, you know, a lot. Like one session will be what a person maybe can do the effort to do in the whole month for having psychotherapy. So obviously, right now, I think psychotherapy, people talk more about it. It's like not a taboo topic right now, and people have different opinions about it, but people are talking about therapy, mental health, anxiety after COVID. Like, just to give you an example, a really old man, and it was my landlord. He had like maybe 88 or something. And when before 2020, 2019, I went and he was like, oh, you're a psychotherapist. Okay, I need you someone to come and say they can pay for you if you cannot pay rent. Like it was a general knowledge that psychologists are poor, you know, because it's psychotherapy, you know. And then when I left, like 2021, he was like showing the flat to other people while I was there. And he was like, and she's psychotherapist, you know, because after 2020, it's like psychotherapy was like huge deal, you know. It's like everyone was needing psychotherapy and it was like forced, you know. It's like, or I really go to shit or I do this. And psychiatrists, like people are sick and they don't know what's wrong. They go to the doctor. The doctor say your body is okay. You should go to psychotherapist. So they go to the psychiatrist for pills, and they go, yes, I can give you pills, but you need psychotherapy. And then they go to the psychologist. You know, it's like a process sometimes, and they always come with like this kind of prejudice. But I think
little apprehensive, huh?
yeah, depending of the age, obviously, the older you are, the more like let's see, but they're desperate, you know. If you have like 10-year depression and then you add COVID, obviously you're struggling.
Yeah. What is your society teaching about child-parent relationship and how these teachings influence the therapy? Yeah.
But I think obviously we are realizing after a global trauma like COVID, we're realizing we have traumas, and many of those traumas come from childhood. So I can see many of my millennial friends or people around that is like blaming the parents, you know. So I think the society, it's changing a lot, because there used to be a tendency that men work money, woman taking care of kid, house, you know, that tendency that it changed in the past 40 years. So right now it's a different thing. So you can find people that are like men stayed at home and woman working, or then you can find the same structure I told you, or then you can find like co-parenting differently. But what I can say for sure is that parents that had done therapy are more aware that they can traumatize their kids with their own unsolved traumas, you know? If you have an issue and your parent hit you, you don't want to hit your kid, but you're so focused on not hitting the kid that you forget the rest, you know?
Everything else, yeah. Mm.
So I will say that it's not that it's teaching something. This society is not like teaching or critical thinking. I think that every person is having their own process. Right now, we're all traumatized after COVID. It's like you had your life and then something out of your power, out of your league told you no. You need to stay inside home and face yourself, be with your family or depending on the situation. So I think right now people are more aware that we all have child traumas or some type of unsolved things going on. And if you want to be a parent, you should look into that. So I can see many of my cousins, for example, that are same age, they, if they want to have kids or no, many of them is like, I want to have kids, you know, because they know you can traumatize a kid. They know the world is really crazy. So it's like, do I want to bring life? So it's a lot of, in this generation, it's like changing. So I, for sure, just to answer, I don't think that the, the, the thing that we are taught by life right now, it's that a parent can fuck you up. I mean, you know, so if you deal with your traumas, maybe you are not going to put that into your kid. And that's important.
So what you are saying, more and more people are gaining this awareness.
Exactly. And even people that are already like parents with grown-up kids, it's like it's never too late. You know, even my own mom, she's been like 2 years in therapy, and I kind of did a like an emotional extortion. You know, I was dealing with a really rough period of my life, and she was like really like a Chilean mom that is like, I will cut my arm if you told me that will make you feel better. And I'm like, you know. And then I told her, if you want to help me, I need you to help yourself first. And then she started going to therapy because I pushed her, but she continued because she wants to. And she's been improving a lot. And I can see she has solved her own traumas. And I can solve mine because it's like, you know, a healing process that is, she's helping herself and that is helping me in a way, you know? So I really think we're more aware of that right now. And I think the next generations, they have their awareness and they will have other issues, you know?
Yeah.
But that's the way it works.
What are the learned beliefs regarding client therapist relationship, and can the relationship continue outside the therapy?
To be honest, I've heard of different approaches as the one I have. For me, to be an ethical psychotherapist is the most important. So I can talk about me and then I could talk about what I see, what I think. But for me, it's a unique bond that you have with your patient, with your client. And I think there are like beliefs. I just try to create every bond is unique. So it's like people come with their own beliefs of how is therapy, what they've heard or what they have previously with another therapist. But I try to be more open to create something new and try to put it on the client, not on me, but always having like a barrier. Because answering the second part, for me personally, I could not continue having a friendship, for example, with a client. No, but if that client and I discharge them and they're living the lives and they are so happy and they want to share something with me because I was important in their lives, I will be so happy. But I will not continue a relationship because for me, they come to me asking for something, and then my goal is for they not to need me. Like, to this person that comes from help, okay, I will give you this, but then you will not need me to do what you want. That's the idea for me. The idea is that they maybe will not need therapy again. I don't want to keep a person like 5 years with me, or 7 years. But I know there are different approaches. I've seen people that have been like 5 years, 7 years, and on therapy, myself included. But I think there are people that they just come, they can learn, they can grieve, they can, learn how to do the things they don't know how to do. Pass through depression, being taught how they want to live their lives, and then they go and they don't need me anymore. So I don't continue the relationship more than in a professional, strict way. I have social media and WhatsApp, for example, just for my clients, different number, different rules than the one I have from personal account. I try to separate that, but I 100% myself when I'm with them as well. If I use my own experience, usually, because sometimes what I have in hand, to try to explain something, to try to share something. So I try to be 100% me and human, but at the same time, there is a boundary, and we all know it.
There's some sort of regulations, going on, or different approach, different rules? Because I think in my country, you can, in some approaches, become a friend or even get involved in romantic relationship after half
Oh
a
my
year or 2
God.
years. So are there some sort of regulation in Chile?
I will say that I've read all the law, but ethically, socially, I would not say legally, but you cannot have a romantic relationship with someone that was your patient. And right now here, the regulation, to be honest, in the public system, you have more regulations because it's an holistic system, multidisciplinary, and they have like their own rules. But when you're independent like me, it's like you can do whatever you want. So I've heard really shitty stories people had in therapy. Therapists, for example, telling people really things that kind of stuck in them. I had clients that had come like, I don't believe in this anymore, but I'm desperate. And then when I asked why, they told me like, a therapist told me, like, they kind of the approach they have, it was more about my therapy and not what the person needs. So that is like, there is like a miscommunication and that type of thing when you go vulnerable to ask for help and then someone tells you, yes, you're being an asshole, instead of, okay, but do you think you've been an asshole? It's like different, because we're in a power position and we have to be careful and we have to be mindful about that, because if we say something, we judge or prejudge, or we just say something that it's our opinion that we can talk, if we are not in psychotherapy, we can make a damage in someone. So we have to be careful with that. And sadly, in the private system, there is not a regulation. There is like a thing you can do. You have your rights as a patient, but the psychotherapists that are online, for example, they don't have the thing they have in the public system. So the clients, they don't know their rights. They don't know. So sometimes I send the consent to a new client, and in the consent we put the image that says these are your rights and your must. I mean, you must not treat me shit. Like, you cannot trespass my privacy, that type of thing. But then if you think I'm being like this, you are in your right to ask for this. And they are surprised, like, I didn't knew these were my rights. So I can tell that in the private system, there's a lot of unethical work. But there is not an entity right now that is like, hey, you're doing wrong. No, it's yourself.
Okay. Okay. Is supervision a must in your country?
No, it's not a must, sadly. I think that's a topic, because for me it's a must, for my colleagues it's a must, for the people I I'm in life, it's a must. But sadly, it's not a must legally, or it's not a must for many people. Like I know that some people, they don't supervise, they don't go to their own therapies if they need. They're just come here, work, and I don't think that's ethical because we're just human and we need supervision. We need it because there are things that we are not perceiving of ourselves, things that we're putting there. So sadly, it's not a must legally, but ethically for me, I think it's a must.
Yeah, definitely.
Yeah.
And what are the most common complaints that a client comes to therapy for?
I haven't had a new client in like maybe 3 or 4 months, but I can tell you at least the past year and a half, it's all trauma related. You know, people with some post-traumatic stress symptoms, people with complex trauma, people with personality disorders, but when you check, there is trauma there, grief. That's the thing people have come to me the most. But I think obviously it's some bias because they're mouth to mouth. So a client is like had a friend of a friend that she's going to grief and is looking therapy, and they, oh, my therapist is good with that, so they say my name. But I noticed that 2020, for example, or end of 2019, it was starting to be trauma related. And what I can say for sure, even if they don't come actively for that session, anxiety, it's a part that I have to work with my clients.
And if you would share one tool, belief, or approach that is a must-have for you as a therapist, what would that be?
I would say just to be more human, you know. I mean, the studies have shown that only the good thing in therapy, it only goes 15% of the theoretical approach. So it doesn't matter if you're psychodynamic, if you're relational approach, if you're cognitive behavioral. I think they all have good things that will help people. So what I would say for every psychotherapist is just not thinking that what makes sense to you, it will be perfect for everyone. I mean, I'm for sure thinking that my approach will not help some people. So I will say that just to be more open and supervision. I will say.
And when you say more human, what do you mean by that?
Yes, I didn't express myself really well. We as therapists, this is a personal opinion, obviously, for sure. This is not the truth, but for me, what I've learned, what I would like someone would told me before, is that to be here on the therapy, on the oh my god, theoretical approach, you know, to be on exactly, to be here like, okay, this is the way my therapy is done, so I have to do it. I have to follow these steps. When you do that, when you're focused on, I have to take notes because I will forget, when you are in your head, you just forget the most human and healing thing of the process. That is like 60% of the process, the numbers told this, but you can feel it. It's like when you're human, when you left everything and you're as a human in front of another human and trusting your tools, trusting you, I think they are the best sessions, and you can help more because you can see the other person, not through glasses of, you know, this is the way I do therapy. Oh, I need to talk about this. This is what I, you know, structure, mind, thinking. Sometimes we just have to lose that and just be in the session.
We went through all 8 questions, so I am really thankful that you did this interview with me.
To be honest, this is amazing. I am so curious of what would you find out of this. These questions help me a lot to think about me, and that's what, like, you know, supervision does sometimes. Think about you, make you stop a little bit and just, okay, let's see. I found it amazing what you're doing, so thank you.
Oh, thank you.
Are you a psychotherapist and want to be a part of my project? Feel free to contact me through my webpage. Thank you for listening.